dressed to get in the chamber. I don't have on anything under here but my, because we're not supposed to wear anything metal. And of course they gave me some shoes here and some socks. Can you see my shoes and my socks? They're probably not listening. So these are my shoes and socks I've got on here. This is what they're going to be using. I'm excited. I don't know how cold it's going to be.
You ready?
Yes.
Okay.
I want to record this. Let's see. Okay. I think it'll reach.
Oh yeah. Okay, perfect. Come on in. Just watch your step there, coming out. Just close.
Oh, it's gloves. Got gloves.
You're okay. Let me have you. I only have one. Let me have you put.
Is this the other one? Or is this one?
No. If you want to put those on, yeah, you can put those on.
Okay.
Yeah. As long as we have something on your hands.
Oh, got the gloves on.
Alright, I'm just gonna have you watch your head just a moment. I'm gonna lift this up and bring it over your head there. And then we're gonna get you going. So at any moment you, like I said, feel uncomfortable, it's too cold, just let me know. I can stop here. I have an emergency. If you want to know how much time is left, I can let you know.
How cold is it?
It gets about negative 160.
160?
Mm-hmm. Yeah. And it does get cold in there pretty bad. It's a different type of cold. We got sort of the nitrogen
Okay.
that's cooling it for
So
you.
that's nitrogen oxide?
Mhm.
No.
And I just have, whenever you hear the beeping, it's just letting me know that, are you okay, and I hit okay. So, I have to be here to kind of talk with you, because it's, you know, it's, yeah.
So how often do you recommend someone get this?
It depends on how active you are. Because we have a lot of people that work out, so they'll come in once a week.
Yeah, I do too.
Yeah.
This one there.
So a lot of people come in about once a week. But if you're very active, people come in a couple times a week. It just depends on how much you work out. You know, if you pull the muscle or if you're getting a little sore, inflammation, awesome for that. So.
You get that?
It kind of loosens you up. I mean, you feel like $1 million when you're finished. How you doing? Doing okay?
Yes.
Okay. Just letting you know that you're okay. So. But this is real, obviously it's more popular in the summertime. Because it's getting warmer out there, people are more active than in the wintertime. So.
I always wanted to try it. I always thought it was like really, really expensive, so.
Yeah. I know some places can be.
Yeah.
You're all set.
Hey.
All right, just watch your head there. I'll lift this back up. And are you ready for me to open the door?
Yes.
Okay. Just watch your step there.
Oh, this way. Oh, I mean, I know what's so cold. Oh, that was fun.
Alright, I'm just gonna leave this open just like that, and I'm gonna sneak out the room. Just come out whenever you're ready.
Okay. So that's it, right?
Uh-huh.
Oh, cool.
Yes, ma'am.
Thank you. You're welcome. Okay guys, so that was super, super fun. Now, if you're not familiar with cryotherapy, so cryotherapy is pretty much, cryo means cold, freezing. So she said it was a negative 106 degrees Fahrenheit in there. So that's the coldest temperature I ever experienced in my life. I was only in there for about 2 minutes. Now this is good for weight loss because it increases your metabolism. just keep your blood circulating. And when you're in there, you see I have to wear my gloves and got socks, socks and shoes on to prevent frostbite, because like I say, it gets a negative 160 degrees in there. And like I say, I just did the oxygen bar. I'll post that video too up front, and it was amazing. I feel so refreshed at this wellness center. So cryotherapy pretty much just loosen you up and increase your metabolism. So a lot of people come here to get like a jump start on weight loss. As you can see, the process was very short because it's super cold in there, so I can't be in there for too long without having complications. Now, for people who have any type of circulation disorders, this is not for you. Talking diabetics, people with heart problems, this is definitely not for you because it can impair your circulation and it numbs you. So people who are diabetic, you know, they have problems feeling things, and that can numb you to a point where if something was to happen, you won't be able to feel it. But overall, this was amazing. So this, like I said, this is a non-medical treatment, but you do want to get permission from your doctor before you do something like this. This is, like I say, it freezes off fat, which a lot of people like to do this. And I don't know if you heard her, she was saying how a lot of people like to do this in the summertime because people are more active, so their metabolism look a little bit higher because they're constantly active. And this will kind of speed up their process. So I see a lot of bodybuilders doing this, and I think I'll probably do this a couple times before my show, and stay tuned for that because I cannot wait. And like I say, it treats mood disorders by causing a psychological hormonal response, including the release of adrenaline and all type of different endorphins. Possibly can prevent dementia and Alzheimer's disease by having an antioxidant and anti-inflammatory effect, and can oxidize the stress response that occurs with Alzheimer's. And it can treat atopic dermatitis, another skin condition, by improving the antioxidant levels in the blood and stimulating and simultaneously reducing any type of inflammation. Like I said, the side effects are numbness, tingling, redness, irritation of the skin, which is temporary, but it doesn't, and if it doesn't resolve in about 24 hours, you might want to call your doctor. And never use cryotherapy for longer than 4 to 5 minutes. And as I say, diabetic or people with nerve damage should not use cryotherapy because they may be uncomfortable and unable to feel it, and it can cause more nerve damage. You also want to wear dry, loose-fitting clothing, gloves and socks to prevent frostbite. And you also want to move around while you are in that chamber. And I feel amazing. I came here to the oxygen bar and the cryotherapy, and my day is just beginning. It's early in the morning, so I still have the rest of the day to myself and enjoy this very necessary treatments that I got today. And I appreciate you guys for watching this video. Tell me what you think about this cryotherapy.